Hello and welcome to my presentation of human immunity. I'm Samantha Sullivan. In this presentation I will discuss the first and second lines of defence, how they fight against disease, explain the third line of defence and the roles of different immune cells. I will then explain self-recognition of our tissues, transplant rejection and describe two autoimmune disorders. Lastly, I will explain acquired immunity, the immune response to vaccinations including immunological memory, evaluate the benefits of vaccinations by analysing measles infection rates, and discuss herd immunity, vaccination programs and factors affecting vaccine uptake. The first and second lines of defence are the tools that our bodies use to fight infections. Infections are microorganisms that enter the body, such as bacteria, parasites, fungi or viruses. Whilst humans have bacteria in their body, it is healthy bacteria and is not classed as infection. Microorganisms can multiply throughout the body or can stay local to the part of the body it is attacking. Not all infections are easily detected, as some are asymptomatic. Bacteria are single-cell organisms that enter the body and multiply to cause a reaction. Such infections caused by bacteria are UTIs, TB and MRSA. Bacteria can double every 4 to 20 minutes, so therefore spread rapidly to create illness. Viruses are smaller than bacteria and require a host for reproduction. Viruses cause colds, chickenpox, mumps and measles. Fungi are the type of disease you would see in athlete's foot or ringworm, as it attacks the surface of the skin. It is very visible but can also attack the lungs and the nervous system. Parasites are found in malaria and enter the body via injection, such as mosquito bite. Parasites can also be ingested via animal feces. Infections have routes in which to attack the body's immune system, and these are by direct or indirect contact, air or waterborne, droplets, vector or foodborne. Direct contact is through touching, kissing or sexual intercourse. It can also be passed from mother to unborn child through the umbilical cord. It is important to remember that some people are asymptomatic, so it is hard to determine if they are infectious. Indirect contact can be droplets from sneezes or dirty tissues not being disposed of correctly. Another route of infection is food contamination. Illnesses such as E. coli occur from eating contaminated food. There are three lines of defence against infection in our immune system. The first line of defence consists of chemical and physical barriers to prevent passive pathogens from entering our bodies. The first of which is our skin, which acts as a barrier to foreign bodies and pathogens. It has three layers: the epidermis, dermis, and the subcutaneous. The epidermis is the top layer of your skin and is a barrier to anything trying to get into your system. It is waterproof and produces new skin every 28 days. The skin has melanin, which protects the body from UV rays by darkening. The skin plays a vital role in your body's line of defence against pathogens entering the body. The epidermis prevents and impedes penetration of microbial organisms, chemical irritants, toxins which can cause inflammation. It absorbs and blocks solar and ionised radiation and inhibits water loss. The skin must be unbroken to prevent any pathogens from entering. The other first line of defence is mucous membranes. These are coated with secretions that fight microorganisms to form a defence system, whilst at the same time allowing nutrients to get through. They cover the external and internal parts of the body, typically found in ears, nose, sinuses, mouth, throat, gastrointestinal tract, respiratory tract and eyes, specifically in tears to fight infection. Illness occurs when these defence mechanisms have been compromised, meaning they are not as effective, hence why people exposed to the same germs respond differently. If our defence system has been compromised, then pathogens are able to enter, causing illness. Multiple parts of our body contain mucous membranes, but one example is the nasal cavity. The cavity is coated with mucus and hair, and under the surface are blood vessels. The nasal cavity is the first line of our respiratory system and prevents any pathogens from entering through the nose in the form of sneezing or blowing our nose to remove any unwanted pathogens. Another good example is that of the urinary tract. This has excellent barriers of defence to avoid UTIs, but as the urethra is so small, pathogens can enter this way for both men and women. However, when the bladder empties, most of them are flushed out of our system. The second line of defence begins where an injury or an infection occurs. The body's natural defence causes inflammation. First to respond are the white blood cells that can multiply around the site. These dilate to form inflammation. The cell walls then open to allow the blood cells to pass through and around the damaged site, thus making the immune system stronger. This, along with proteins, makes the immune system strong enough to fight the injury or infection. As well as this, the site of the injury may feel hot. This is acting as an antibiotic to heal the area. The three main symptoms you may find around the site the infected site are redness, swelling, and heat. You may see pus oozing from the site. This is the debris left from the fight between the immune system and the infection. Once the infection is gone, the area should return back to normal. The second line of defence causes fevers. This is because the body is trying to kill off the bacteria causing the infection. It is harder for bacteria to survive in feverish conditions because we sweat them out through our pores. At the same time as this chemical, signals are being released as part of the second line of defence, and this process is called phagocytosis. During this process, phagocytes or macrophages engulf the area and absorb the pathogens and move them to a vessel called a phagosome. This then fuses with lysosome to produce a phagosome. Filled with enzymes, the phagosome destroys the contents. When inflammation occurs, the macrophages develop from monocytes. Within the second line of defence, there are also small proteins called cytokines. These enhance the immune system by signalling and medicating inflammation and immunity. Through cytokines being present, others may follow and cause a cascade effect. Some examples of these are interleukin, monokines, lymphokines, and interferons. Cytokines become activated once a pathogen is detected, and working together, they perform the cascade effect, which attracts phagocytes. These then remove foreign particles, initiate inflammation, and produce proteins to fight the infection, causing it to rupture and end the process. Unlike the first and second lines of defence, the third is specific or adaptive. This line of defence relies on antigens and pathogens. Antigens means antibody-generating substances, essentially the body's natural immune system and the antibodies we have or acquire over time from various infections. Antigens are the receptors that tell our body it is being attacked by a pathogen. This in turn starts the process of antibodies being produced to fight infections. The antigen is the type of molecule like protein or fat, and the pathogen needs this to use the antigen as a host to invade your body. Acquired immunity is not something we are born with. This is a learnt system. When we are exposed to a foreign body, the immune system creates the right antibodies to fight the right pathogen. It then memorises how it did this for future illnesses. Acquired immunity has the ability to learn, adapt, and memorise each particular antigen. White blood cells or leukocytes come in 5 varieties: neutrophils, lymphocytes, monocytes, eosinophils, and basophils. These cells are the base for the acquired immune system. Although the immune system struggles to fight off a new pathogen the first time it encounters it, with the ability to create and memorise antibodies, it becomes easier for it to fight it the next time it encounters it. These cells are key to fighting the pathogens it encounters. The acquired immune system is mainly made up of T and B cells, and these are found in lymphocytes. T cells come in 3 forms: cytotoxic, suppressor, and helper T cells. All 3 help to destroy infected cells, including cancer cells. B cells make up about 10 to 15% of the leukocytes and are there to produce antibodies and to present signals and antigens to T cells for it to be able to fight it off. Antibodies come in different forms and are chained into antigens. Antibodies have different jobs to do, including targeting an infection, recruiting immune cells, neutralising toxins, removing antigens, complement activation, stimulation of cells, and can eat foreign substances and activation of mast cells. Formed in the shape of a Y, there are several immunoglobulin. IgG, the most common immunoglobulin, and the only one that can cross from the placenta to protect the fetus from diseases it has not yet been exposed to. This immunoglobulin can stimulate a direct attack on any foreign body that attacks the immune system. IgA, acting as a cellular defence of any soft mucosal surface, is the second most common immunoglobulin. If we do not have enough IgA, then infection can occur in such places as the mouth and throat. IgM, comprising of 5 immunoglobulins joined at their bases, it is the first immunoglobulin to respond to antigens appearing. IgE, this is the largest molecule, but we only have low levels of it. In a response to a parasite infection or an allergic reaction, more of this molecule is produced. Hay fever is a condition caused by too much IgE activity. IgD, it is not known exactly what this molecule is used for, however, it may act as an antigen receptor on B cells. As antigens are present on cells, the immune system needs the ability to be able to differentiate them between antigens that are bad for us, non-self, and ones that are already there, self, so that it has the ability to attack the bad. It does this by using 2 sets of cell surface proteins known as major histocompatibility complexes, MHC1 and 2, as well as human leukocytes antigens, HLA. These cells enable the immune system to recognise the self-antigens and not give off signals to fight it, and also to be able to identify new foreign bodies. As the immune system does not have a consistent level of response, it will depend on the similarity of the antigens as to the level of response it gives. If it is very similar, there will be a low level of response, and if it is different, signals will be much stronger. Hypersensitivity is the abnormal reaction that the immune system has against repeated exposure to the same antigens. Examples of these are autoimmune disorders. They are categorized into 4 different sections: immediate, antibody medicated, immune complex medicated, and cell medicated. An autoimmune disease is where the body's immune system cannot tell the difference between our own antigens and foreign ones, so it attacks them all, meaning that it leaves the body weak and susceptible to illness and causing fatigue, fever, aching bones, and inflammation all over the body. Causes of autoimmune diseases have not yet been confirmed, but have been linked to environmental factors, drugs, chemical irritants, and bacteria and viruses, as well as genetic. Autoimmune diseases are detected through blood tests, as symptoms are not enough for a diagnosis. With all diseases, you can be susceptible to others like it, and there are no cures for these diseases. Therefore, it is important to be able to manage them through pain relief, physiotherapy, and diet. 2 such immune diseases are MS and type 1 diabetes. Type 1 diabetes is a disease where the immune system attacks insulin-producing cells. Symptoms include excessive thirst, blurred vision, weight loss, and excessive urination. It is classed as a type 4 hypersensitivity. MS, or multiple sclerosis, is a condition that affects the brain and spinal cord and causes problems with movement, bladder, balance, and vision. MS can present with new and/or worsening symptoms over time and then slows down. Steroids are used to treat the symptoms for a short period, and then specific targeted medicines are used to help the bladder control and muscle stiffness. MS is also a type 4 hypersensitivity. So what about transplants? How does the immune system differentiate a new organ from an attacking foreign body? Simple fact is it doesn't always do this and rejects the transplanted organ, thinking that it is a foreign body. If the organ is not closely matched, the immune system may recognise it as foreign and attack it, starting the process of rejection. To avoid this from happening, tissue typing should take place before transplantation to lower the risk of rejection. During and after surgery, the use of monoclonal antibodies are also used to stop the T-cells rejecting the organs. The 3 types of rejection are hyperacute, occurring within the first few minutes as the antigens are completely mismatched; acute, happening within the first week to 3 months after rejection; and chronic. This can take place several years after the immune response, as the immune response can slowly damage the new organ and its tissues. Acquired immunity is the resistance built up over time. There are 2 types of acquired immunity, and both have natural and artificial examples. Active is the response our body makes after it has been exposed to pathogens. Natural active are developed antibodies after being exposed to an infection or injury. Artificial active come from a vaccine to create antibodies to fight a potential infection, for example, the COVID-19 vaccination. Passive are antibodies that we receive from someone else. Natural passive come from either the placenta to the unborn child in the womb or breast milk, and artificial passive are the ones found from transfusions or injections given to fight infection but only last a few weeks. Our own antibodies are not used at all. Vaccines are injections that are filled with small amounts of a virus or pathogen, and it is intended to stimulate your white blood cells to signal a response to fight it and create antibodies. This then stimulates a memory response within your immune system so that if they encounter the same antigens again, it already knows how to fight it and will either not make you ill or at least lessen the symptoms. As the injection only contains a small dose of the infection, you are not likely to catch the disease, but you may get a few side effects. If an infection occurs later, the white blood cells will remember these antigens and reduce rapidly and destroy it to provide immunity, and this is called immunological memory. The benefits of having vaccinations far outweigh not having them. Evidence of this is the measles epidemic in the 1940s. Measles cases were very high until the vaccine was introduced, and today we see low levels of infections and even lower deaths. As viral infections cannot be cured by antibiotics, the only way to prevent them is through immunisations. Diseases such as measles, mumps, rubella and polio are all viral diseases that need immunisations to prevent them. Not only do we pose the risk of death from them, but we also other complications such as pneumonia, paralysis, and heart failure are possible side effects. Since the introduction of measles vaccines in 1968, we have seen a rapid decline in cases and deaths, and at its peak in 1941, there were 1,145, compared to those between 2000 and 2020, where there were 23. There was a slight decline in the uptake of measles vaccines when the MMR was introduced, as there was a link between the vaccine and autism. Some of the benefits to vaccinations, as well as immunity from the disease, are that they save the NHS millions, life expectancy is higher, cancer prevention due to the immunisations being developed to prevent them. Herd immunity is the concept of the majority of the population is immune to a certain disease by way of exposure or vaccination. The problems faced before herd immunity can be achieved are that some diseases are highly contagious and therefore spread quickly, for example, COVID-19. Because we as a nation are more social, we come into contact with hundreds of people every day through shopping, work and travel, thus meaning that infection is spread quickly before a vaccine can be found or taken, therefore leaving vulnerable people or people not able to get the vaccine at risk. As we have seen from the results of the vaccine uptake in COVID-19, the rates of infection have lowered and it now does not pose such a risk as before. However, we must remember that other variants may exist and that the vaccine and our own immunity may not have been developed enough to protect us, as well as the fact that some people are against the vaccine and therefore can still be infectious. There are a number of vaccine programs within the UK, but we as a nation are always wary of what they contain and the side effects they cause. Especially as parents, we want to know that a vaccine we give our child is safe, for example the MMR vaccine and its link to autism. It has, however, been proven that the rates of infection that the vaccine far outweighs the potential risk of not having it. If we look at any statistics, for example diphtheria, the cases in the 20th century have amassed 175,885, and in 2006 there were no cases at all, thanks to the vaccination programmes. Some of the vaccination programmes in the UK include influenza, MMR, PCV, MenB and HPV. However, as great as these are at helping us become immune to the diseases, there are a number of factors that affect the uptake of them. Convenience. Although pharmacists have now been registered to administer some vaccines, due to other commitments like children and work, people put off having vaccinations. Trust. Due to media and other sources, many vaccines have been perceived as unsafe. Anti-vaxxers believe that vaccines do more harm than good and cause other diseases. Education. People do not read up on the information about various vaccines and have preconceptions on them and the side effects. Benefits. People weigh up the benefits of having the vaccine against not. For example, a person is more likely to worry about giving their child an immunisation than taking the flu jab themselves and having time off work or maybe getting some side effects. Cultural beliefs. Some cultures do not believe in immunisations, therefore posing a threat and risk to others that have a weakened immune system. This concludes my presentation on human immunity. Thank you for listening.